Hello everyone, my name is Olabisi. Welcome to my YouTube channel, Microbes Daily with Olabisi, where you'll be learning about different microorganisms, the disease they cause, and how they can be prevented. So today we'll be talking about Acinetobacter baumannii. This organism is a rod-like gram-negative bacteria, and it is an obligate anaerobe. That is, it can only survive in the presence of oxygen. It needs oxygen to survive and to grow. So it can be an opportunistic pathogen. That is, it takes advantages of opportunities that are not normally available. For example, they can attack patients with weakened immune system. Also, it is also known as an escapee pathogen. That is, there are groups of pathogens that have high rates of microbial of antibiotics resistance. They are resistant to some antibiotics and some drugs. Also, they can also cause nosocomial infection. That is, these are infections that are hospital derived. They can be gotten from hospitals or healthcare settings. So, a very interesting thing about these organisms is that they can live on patients without causing any infection. They can live on them without causing them any harm, and they will just be carriers. But these people can spread the infection to somebody else. So, this organism causes various range of serious infection. We have UTI, that's urinary tract infection. We have wound infection. We have secondary meningitis, and we have pneumonia. So, this how do you know that you have been infected by this organism? It takes 4 to 40 days before the symptoms of the infection starts to show. Mostly 12 days, but within a range of 4 to 40 days. And the symptoms that you can observe to know that you are already infected. We have foul smelling urine, like your urine will be like smelling really bad. We also have fever, chills, we have cough in pneumonia, and also on wounds you'll be seeing like redness around the wound or pus and serious pain around the wound. That is a symptom of wound infection caused by Acinetobacter baumannii. So, how do we get this infection? You can get it through direct contact, that is, touching an infected person or coming in contact with their bodily fluids. Also, you can get it through indirect contact, that is, touching contaminated surfaces, medical equipment. So, also, you can also get it in an healthcare setting, like now, an healthcare worker, like a nurse. Like healthcare workers can spread this infection by touching an infected person and going ahead to touch another patient without washing their hands or sanitizing their hands. And how can we prevent this infection? First, we all know one essential way of preventing infection is washing of hands. Wash your hand for 10 to 20 seconds with soap and water. Wash every part of your hand in between your fingers, your palms, and everything to get rid of these microorganisms. You can also use alcohol sanitizer, at least 99% alcohol sanitizer. Also, wash your hand. For example, an healthcare worker, you should wash your hand after attending to a patient, touching bedpans, touching medical equipment to avoid cross contamination. And also, before eating, I have noticed that it is very common for we people maybe on the road. You just buy something, you don't wash your hand, you just go straight to eat it. So let's always try to go around with sanitizer in our bags, because you may not have access to water and soap on the road to wash your hand. And also, whenever you want to visit a patient, you should wash your hand before visiting the patient and after visiting the patient. This will help to prevent the infection. Thank you very much. Don't forget to subscribe and like this video.